Mom Theresa Cabel has two active, healthy children.
Scarlet and Harrison, 4 and 1.
When it came to Harrison, his one Achilles heel was his ears.
About every month, we would be going to a doctor to get it checked out.
Ear infections are one of the most common reasons behind visits to the pediatrician.
Partly because little kids get more infections, and partly because their anatomy is set up in such a way it puts them at risk.
Especially in children under 3, the immature drainage system in the ear is unlike that of an adult. Adults have ear tubes which sit vertically, allowing gravity to drain fluid. It's not the case in young children.
In little babies and kids under 3, it's more horizontal and flat, so it's not very effective. So they have a tendency to build up fluid and build up air pressure, and if fluid sits in there long enough, you can develop an ear infection.
If the infections are too frequent, it poses additional risks about the overuse of antibiotics. Doctors have approximate guidelines. If a child has an infection 3 times in 6 months or 4 times in a year, it might be time to talk about ear tubes.
Ear tubes are supposed to kind of take the place of that non-functional drainage tube in the backside of the ear. It's a vent, basically, through the eardrum.
It's a minor surgery performed under anesthesia that takes about 20 minutes.
A little incision is made in the eardrum, and then the plastic tube is placed through that incision. Usually they'll fall out within 6 months to 18 months.
Little Harrison was on the cusp of getting ear tubes, but the infection frequency died down.
All the medicines he was having to take, that was a possibility for him if it didn't get cleared up soon.
Ear tubes can often be a good solution to ease the pains of childhood. For Lee Memorial Health System, I'm Amy Oshier.